I'm going to start by introducing our panelists that are joining us today. The first is Dr. Ramy Abou Ghayda. Ramy is a urologist, a male fertility specialist, and a researcher. He's also the chief medical officer here at Legacy. Thanks for joining us, Ramy. We also have Jordana. Jordana is the client experience manager at Legacy, so she's really well-versed in everything about the Legacy process, so she'll be talking a little bit about that. Thanks, Jordana, for joining us. Okay, so this is a webinar. You can see us, but we can't see you. So if you have a question, you can place it in the Q&A box at the bottom of your screen, and we will have a few minutes at the end of the session to answer any questions that people may have. So let's get started. Okay. So Ramy's going to kick it off.
So welcome, everyone. It's a pleasure being here and doing some educational activities. You know, it's a very sensitive topic. Everyone has so many questions, so we'll try to answer as many questions as possible. So let's start by defining what's sperm freezing, right? So sperm freezing is also called sperm cryopreservation or sperm banking. It's basically the procedure to preserve sperm cells. The idea here is easy. We want to freeze sperm and store it for future use. The process is simple. It's 3 steps. 1, the man would be providing a semen sample, typically by ejaculating via masturbation. The sample would reach the lab would analyze the sample, make sure it's adequate and satisfactory for freezing, and then the sperm sample will be frozen and stored for later use. Once the semen is stored and frozen, it can be used successfully indefinitely. So this is basically the general idea behind sperm freezing. Next, please. So you would ask yourself, why would I freeze my sperm? It's a relatively cheap insurance policy to guarantee future fertility. Sperm banking is the best protection against infertility, and it offers couples the option of having their own biological kids at any point in time. Sperm freezing gives individuals the peace of mind that they will have better chance of having their own children in the future. Basically, it's recommended for all men who are interested in fertility. So irrespective of the number and the quality of the sperm, as long as the sample meets the minimum standard criteria for freezing, the specimen can be frozen and banked. It is very important to stress that there are no increased risk of birth defects or any genetic abnormalities in men opting for sperm freezing. Among thousands of children who were conceived using a frozen sperm, the incidence of birth defect and genetic abnormalities has been no different compared to children conceived with a natural way. So it's basically a very safe and easy way to decide on fertility in the future. So there are many benefits for sperm banking and sperm freezing. You will have the option to extend the chances of fertility and having a family from the present to the future. It will give you the option to store normal sperm now to a future time, which maybe you're only having only abnormal sperm or no sperm at all. It will basically also allow us to use these frozen sperm for IVF or IUI, and without the need to produce a new sample at the time of these assisted reproductive techniques. It's reliable, it's safe, and confidential. And many studies have showed that using frozen sample had the same success rate for IVF compared to a fresh sample. Most importantly, it will provide same-sex couples and transgender individuals the option to have their own family. So it's always a very good idea. Next, please. So as we said, sperm freezing may be right for, the short answer is everyone. Everyone who's interested in fertility should be thinking about freezing their sample. We're gonna go into details of groups of individuals and talk why it might be a good idea for them to consider sperm banking. We start by cancer patients. With cancer patients, it's a bit tricky because we have 2 main reasons to consider sperm freezing. 1, certain types of cancer are affiliated with a lower fertility rate. For example, testicular cancer would have a negative correlation on fertility itself. Furthermore, the treatment for this cancer, whether radiation, chemotherapy, or surgery would have side effects. These side effects will for sure produce a suboptimal production of sperm from a quantity and quality perspective. In one study, 75% of male cancer patients were at risk of losing their fertility as a result of cancer treatment. Next. So those men who are planning a vasectomy, at the time of vasectomy, most men are sure that they don't want kids anymore, right? However, a good percentage of them, around 10 to 20% of men, would change their mind or will be in a new relationship, and they will be interested in their future fertility. At this point, they have very few options. They can do a reversal of their vasectomy, or they can do a testicular sperm extractions. These two techniques are really expensive and hard to do, and their success rate is not great. So freezing a sample before vasectomy will give you the peace of mind that anything that would happen in the future, any change of mind, you'll have some sperm for you to use for IVF or IUI. Next. Member of the military. Member of the militaries have higher risk factor. They are mostly exposed to more chemicals, more artificial substance from the weapons, and they are at high risk of injury in the battlefield. So freezing their sperm will give them also the peace of mind of having a future family wherever happened in the battlefield. It will also give them the flexibility to start a family regardless of their deployment. For example, they can start their IVF cycle and they can do their fertilization whether they are physically present with their partner or not. So it's a very good idea for these members to also think about freezing their sperm. Trans women. So the process of transferring for a trans individual is mainly important because you will need to take estrogen. The idea here is you need your testosterone level to go down. Testosterone is very important for sperm production. When you take estrogen, you're going to decrease your internal production of testosterone. Testosterone is super important for sperm production. So before starting any hormonal therapy, freezing the sperm would avoid all of these side effects from a fertility perspective. Next. Men using testosterone replacement therapies. As we said, testosterone is really important for sperm production. But the most important part of testosterone is the testicular production of testosterone and not the circulating testosterone. So when men are injecting themselves with testosterone or they are on a testosterone replacement therapy, even though their circulating levels of testosterone is going to be elevated, the intratesticular testosterone is going to be low, and this is the only thing that matters. So the brain will give signals to the testicle to stop producing their testosterone levels. And when they stop producing their internal testosterone, sperm production is going to be down, and they're going to have suboptimal numbers and quality of the sperm. Next, please. So basically, any man who is interested in conceiving in the future, whether they have a normal number or abnormal numbers. So if they have abnormal numbers, they can lock the numbers. And if they have good amount of sperm, then they will have a good sample. So on both extremes, if you have good number, it's a good idea to lock it. If you have low number of sperm, it's also a good idea because you don't know if in the future you're going to have a further decline in the parameter and the quality of the sperm. Next. So we know that nowadays we're seeing more and more advanced paternal age, meaning that men are deciding to have future family when they are older. However, the quality and the quantity of the sperm will decline with age. So we know that we have around 0.8% decrease in sperm motility, 0.6% decrease in sperm morphology, an increase in sperm DNA fragmentation index, and a new genetic mutation carried by sperm by around 1.5%. So a man who's trying to conceive after the age of 40 will have a higher risk, one, of having more problem conceiving, they will need more time, and they are at high risk of having more genetic abnormalities. So locking their good sperm at a younger age would be a great idea. couple undergoing fertility treatment. So sperm freezing, as we said, is a very good idea for both patients. If you have a good number of sperm, you want to lock these numbers. If you have a low number of sperm, you want to also lock it because you don't know if these numbers are going to further decline. So when you use a sperm freezing, then you have the chance of proceeding with IVF or IUI. Next slide. So IUI is intrauterine insemination and IVF is intravitreal fertilization. Basically, this frozen sperm that's been banked can be used for IVF or IUI. They will take one single sperm, they will inject it in the egg, and this process is called ICSI, or they will take a bunch of sperm and they will just inject them in the uterus, and this is called IUI. IUI success rate are around 20% versus IVF and ICSI, which goes from 45 to 50% success rate.
Awesome.
Yeah, go ahead, Jordana.
I was gonna say, thank you so much, Ramy. That was great. So I'm sure you're wondering what the traditional process of freezing sperm looks like. So before there were at-home solutions like Legacy, you would have to go into a clinic and you'd be put into a room to provide a sample through masturbation. That sample would then be processed and analyzed and then frozen in liquid nitrogen. Oh, next. So how is that different from Legacy's process? Well, not everyone is fully comfortable going into their doctor's office to produce a sample. That's one of the biggest benefits with Legacy, is that you're able to produce your sample from the comfort of your own home. It is recommended that you abstain from sexual activity for 2 to 5 days, with 3 days really being that sweet spot. And after you produce your sample, you can either drop your kit off at your local FedEx drop box, or you can simply call FedEx and arrange for them to pick it up directly from your home. Your sample will then arrive at our lab the following morning, where it will be analyzed. Your sample will be frozen and you'll receive your results within 2 to 3 business days. Next. So something I think it's really important to point out is after we freeze your sample, we conduct a post-thaw analysis. And a post-thaw analysis is a technique that most IVF labs use to ensure that the sample is viable for future use after it's thawed. Legacy is actually the only at-home solution that performs this type of analysis. And why this is so important is because whenever you thaw a sperm sample, there will be a decline in the quality and quantity of that sample. So the post-thaw analysis information is going to be extremely important for you, and if you're using a clinician, to have reliable and accurate data of the overall quality of that frozen sperm sample to use with treatments like IUI or IVF. And then your physician can actually use this information to determine what the best treatment option is for you. Next slide. So I'm sure you're curious how sperm is stored. So sperm is stored in liquid nitrogen tanks at about -200 degrees Celsius. And these tanks are stored at long-term storage facilities that specialize in storing and keeping human tissue frozen. These types of facilities have very strict protocols in place to ensure that your sperm is being monitored 24 hours a day. Something unique to Legacy is that we offer multi-geography storage. So we'll basically divide your vials into batches. We will then separate them and ship them to different facilities using a cryo shipper that's been around since the 1980s with 100% success rate. And why this redundancy is important is the act of dividing the vials and separating them and shipping them to different facilities will ensure the safety of your sample and that they're ready to use when needed. Next slide. So this is a very common question that we get. How long can your sperm stay frozen for? Well, I think Ramy mentioned this earlier, but once frozen, sperm can last indefinitely. And this is evident in a study that looked at live birth rates using frozen sperm and IUI. You can see there's little to no decline in sperm quality, whether the sperm was stored for 5 years or up to 15 years. In fact, there have been reports of live birth that use sperm that was stored for over 25 years. Next slide. So, of course, I think everyone can agree to this is when it comes to fertility, one size doesn't fit all, which is why we've created custom packages to fit your individual needs. Our most basic package is the For Today, which includes one semen analysis from one sample. It does not include cryogenic storage, but you can purchase this or you can add it at your time of purchase or when you receive your results. If you're looking to bank multiple samples and store for long term, the For Tomorrow or Forever may be a better option for you. So within the For Tomorrow, it includes full semen analyses on 2 separate samples, as well as 5 years of cryogenic storage. And with the Forever package, you're getting a lifetime of cryogenic storage, as well as full semen analyses on 3 separate samples. Something else I wanted to add is no matter what package you decide to move forward with at Legacy, you have the option to schedule a complimentary telehealth call with one of our fertility specialists to go over your results in great detail or get any questions, answers that you have. So if you decide to move forward with our analysis only package, we offer flexible storage plans ranging from $14.95 a month to a 5-year plan for $595. So of course, a lot of this information is new for most of you, and it is a lot of information to learn and take in. So if you're uncertain about what plan is best for you, or you just have questions, feel free to schedule a complimentary call with one of our fertility specialists from our client services team directly from our website, and we'd be more than happy to help.
Okay, so I want to go over some questions. Thank you, Jordana and Ramy, both for going over those really important details of sperm freezing. All right, so the first question that we actually got via Eventbrite, and this is one that might be for Ramy. This person says, I'm over 40. Does sperm freezing make sense for me? And I feel like what they're asking and what other people might wonder as well is like, what's the right age to do this if proactive, age-related infertility is what we're trying to prevent?
That's actually a very good question. We don't have the right age. The younger, the better, right? If you want to lock the good number, the very high concentration, the good quality of the sperm, you have to do it earlier on, right? We know that after the age of 40, as we said, there is going to be a decline in the quantity and the quality of the sperm. So the sooner you do it, the better. I think the age of 40 would also be a very good age to freeze, because if you're going to lay more and you're going to take more time, you're under high risk of having lower sperm quality and quantity, and this will definitely affect the time to conceive, the success rate of IVF or IUI. So at any time is a good time to freeze sperm.
And then another question that we got via Eventbrite as well is actually from someone in our chat is, are there risks to the sperm? And Ramy, you talked about this a little bit, that there are no increased risk of birth defects, but are there risks to the sperm associated with the freezing process?
So there are no risk whatsoever. Once you freeze the sperm in liquid nitrogen, it's like you stop time, right? So there is no increase in birth defect, no increase in genetic abnormalities. The success rate when using frozen sperm or fresh sperm are the same, right? So it's a very, very safe. We've been using it for many years, and we know that it's super safe from a conceiving perspective. The sperm would be just frozen as is, and it will have the same properties at the same time it was produced.
Great, thank you. So we've touched on this a little bit, but should you freeze your sperm even if you don't get the best sperm count results if you do a semen analysis? or conversely, should you freeze it if you have amazing results? And I think that, Ramy, you've sort of said it's both.
You should do both, right? The both end of the spectrum are good strategy to freeze. So if you have the good numbers, you want to log this, right? You want to log these good numbers. If you have low numbers, then you have a risk of having even lower numbers in the future. So you want to have like a baseline, freeze the sperm, figure out what's happening, but then you have something, you have peace of mind that at least you have a sample you can use for IVF or IUI in the future if needed.
Okay, so if a couple has trouble conceiving, how can they know if it's the male partner's sperm, the female partner's eggs, or some combination of the two?
So usually there is a diagnostic workup. So let's define fertility. So infertility is the inability to conceive after 12 months of naturally trying with unprotected sexual intercourse. So we have to give it 12 months just because the success rate of natural conception is only 15% per cycle. And this is set by nature, right? We cannot change that. So if a couple is trying to conceive for around a year and they're not able to do so, then we start by the basic diagnostic workup. For the man, it's very simple. We just have a baseline semen analysis to check the quality and the quantity of their sperm. For the female factor, it's a bit more complicated. We need to do AMH level, we need to do some imaging for the uterus, for the ovaries. It's a bit more complicated. But for men, it's just we always start by a basic semen analysis. And if we see any abnormalities, then we proceed to further workup like hormone levels, genetic assays. But we always start by semen analysis.
And Jordana, you have some experience in the female fertility side of things. Is that more or less what diagnostic workup looks like for the female partner?
Yeah, so we're basically looking to make, I guess there's like, if you think of the components to trying to conceive, it would be the eggs, the sperm, and the environment. So Dr. Ramy mentioned that, yes, we're going to look at the overall ovarian reserve of the female patient. So looking at their AMH or their, which can represent their ovarian reserve. And then some of the diagnostic testing that Dr. Ramy was referring to would be getting like a imaging test of the fallopian tubes to make sure that they're open, as well as the uterus to make sure that there's nothing that would prevent the transfer of the embryo or the fetus.
Thank you. Okay, so this is a question sort of about the process of legacy. So who can help interpret the results if this person has questions after they do a semen analysis? So Jordana, maybe you can explain how that works.
Yeah, so after you receive your results, you will have the option to schedule a complimentary telehealth call with one of our fertility specialists to go over your results. And you can do this directly from your client portal. You could also reach out to someone from our client services team via email, or you can call in and they can help get that scheduled for you.
How long does the process of sperm freezing take? And are there things that someone should do beforehand to sort of prepare themselves for that?
That's a great question. The process can take around a week. So just to go into that in a little more detail, as I mentioned, when you order your legacy kit, you can receive it as soon as the following day. Again, you do want to make sure that you abstain from sexual activity for between 2 to 5 days. So you can plan that before you purchase your kit. And then once you produce your sample, we do provide a prepaid overnight shipping label to guarantee that your kit arrives at our lab the following day. And once they receive it, you should receive your results within 2 to 3 business days. Some things that you want to keep in mind besides abstaining is that before you produce the sample, you want to make sure to wash your hands, make sure that the genital area is clean, and you want to avoid using any lubricants or saliva when producing the sample.
Thank you. Okay, someone wrote in, military couple undergoing IVF. Would you be able to speak to the process of retrieving the frozen sample once a couple has made the decision to move forward with fertility treatments? I think, Jordana, you get a lot of questions about this process.
Yeah, definitely a question that I hear often. So with Legacy, we just ask that you give us around 30 days notice that you're looking to transfer your sample out. And if you can provide the clinic information, that'd be great. We can only transfer your specimen to a legitimate medical practice. The reason why we're asking for 30 days is we want to make sure that all the appropriate and necessary paperwork and documentation is completed by you and your clinic prior to the transfer. There is a withdrawal fee of $250. If you move forward with one of our larger packages, like the For Tomorrow or Forever, that withdrawal fee is waived for your first withdrawal. And this is something that we would definitely reiterate to you once you request that you're looking to transfer your sample out, so you have all the right information to move forward.
So it goes directly to their clinic and their doctor. They don't need to worry about transporting their liquid nitrogen tanks and all of that.
Yeah, yes, of course. So we work with a courier service who will provide the nitrogen tanks, and they will transfer the sample from our long-term storage facility directly to the clinic. And we will also make sure to provide all the necessary paperwork, like the thawing instructions and the client's semen analysis documentation like that.
Great, thank you. Ramy, this is a question for you. On the topic of a trans person who might want to freeze sperm prior to their transition, what's the youngest that somebody could really choose to preserve their fertility?
Anytime after puberty. So as soon as they can produce a sample, usually via masturbation, they'll be eligible to freeze their sample. And then the sooner they do it, the better, right? Again, we said that for trans individual, they're gonna need estrogen to counteract the testosterone in their bodies. Once you decrease your testosterone levels, the sperm production is gonna be suboptimal for sure, because testosterone is very important for spermatogenesis and sperm production. So it's very important for these individuals to freeze at least 1 or 2 samples before starting any hormone replacement therapy.
Got it. Okay, let's see. There's a couple more questions. Thanks, you guys, for answering all these. Is this covered by insurance? I think that might be sort of variable depending on the person's insurance, but Jordana, generally speaking, do you see that this is covered by insurance?
Yeah, that's a great question. And Legacy is actually the only at-home solution that has some insurance coverage. And the reason why I say some is we are currently in network with New York-based plans. So Cigna, United Healthcare, and Aetna of New York. If your plan is outside of New York, unfortunately, we are not in network yet, but I promise that is something that we are working on.
And Alicia, I have to add that the prices at Legacy are not comparable to anything that they're doing at the hospital or big academic center, right?
Yeah.
The service that we provide to Legacy is very affordable. It's relatively cheap if you compare it to these huge bills from any hospital or big IVF or fertility center.
Yeah, I can, sorry, go ahead, Alicia.
No, I was going to say Ramy works in the hospital, so he's probably familiar with this every day.
And I can attest to that. I worked at a smaller boutique fertility clinic, and to freeze a sperm sample, it was probably double the cost of what Legacy charges. And to keep your sample stored, the prices can really range anywhere from like $600 to over $1,000 a year. So Legacy's prices are definitely very, very competitive compared to the rest of the space.
And Jordana, if someone wanted to get a forever package with lifetime cryogenic storage, do they have to pay for that all at once, or can they set up like financing options, or like what's the process there?
Great question. So we do have financing options available at checkout. They have the option to pay off their Legacy package monthly, and this is available to the For Tomorrow and Forever plans, which is great.
Okay, let's do one more, and this is a really juicy one. So Ramy, this one's for you. I have seen news about general decline in sperm count. We see this news every single day. Can you highlight what factors are contributing to this and what I can do to improve my sperm count before freezing or just in general? That's a big question.
It's a very good question. So we've established now, and the scientific community has a consensus that the sperm parameters are declining, right? If you compare semen parameters 50 years ago and now, we have seen a major decrease in number and quality of the sperm. We don't know exactly one single reason for this drop. You know, it's a very complicated process. It's multifactorial. It has to do with lifestyle. It has to do with environmental exposure. It has to do with these a chemical that disrupt the endocrine system. Again, it's really good to be aware and conscious about all of these factors, but it's very hard to avoid them, right? So the chemical that would disrupt the endocrine system that's responsible for sperm production, they are abundant. We use them in the everyday life. They include like plastic, bisphenol S, BPA, BPS. So they're present in most packaging, nylon. The environmental factor could be like pollution or any like work-related exposure. And we know from a lifestyle perspective that we have lifestyle risk factors that are correlated with negative semen parameters from a quality and quantity perspective. So we know that anything that's healthy for your overall health and well-being is good for sperm production. So if you eat healthy, a lot of green stuff, like kale and spinach, no added sugar, no trans fat, no processed food. If you exercise around 4 or 5 times per week, if you sleep around 7 hours per night, all of these factors are good for your overall health, and they're going to be good for sperm production, right? We know that anything that would increase the temperature of your testicles would also negatively affect sperm production. So the testicles, they sit outside of the body for a specific reason, because they like cooler temperature compared to the internal body temperature. So very frequent use of hot tubs, jacuzzi, saunas, very tight underwear. If you put your laptop on your laps for extended period of time, all of these factors might increase the temperature of your testicle and could be correlated with negative semen production and quality. And finally, we know that excessive alcohol drinking or smoking or any recreational drug or marijuana have also been correlated with negative semen parameters. So we're talking here about excessive use, right? The regular social drinking is fine. 1 or 2 glasses per night is fine. But excessive alcohol or excessive smoking or excessive use of marijuana might be bad for sperm production.
So if someone had a semen analysis and maybe there were some areas where they identified that could be improved, would you suggest that they like try to improve their sperm and then get another test and before they?
So they need to be conscious and aware about these lifestyle risk factors, right? If they're doing it, they need to stop doing it basically. And then the sperm cycle is around 70 to 80 days. So they need to wait for at least 3 months after any change for them to see any improvement in the numbers.
Great. Thank you both so much for all of that information. I feel like that was very educational for me and probably for everyone else. If anybody has more questions, you can reach us via our website. Jordana and her client experience team will be happy to help you. And we'll also be sending a recording of this to everybody who has registered. So you can, go back and learn about sperm on your own time, I guess. But thank you all so much for joining us and have a great night.
Thank you. Have a good night.
Yeah.